Hello everyone, I am Dr. Namrata, an ICU specialist. Today is World Diabetes Day, which is observed on 14th of November every year. So diabetes is one of the most common chronic diseases worldwide. It has become increasingly prevalent in India, and in this video I will explain everything that you need to know, from symptoms to complications and to prevention and management also. What is diabetes? Diabetes is a condition where the body either doesn't produce enough insulin or cannot use the insulin effectively. So insulin is a hormone that helps your body turn sugar from the food into energy. The insulin is produced by an organ named pancreas, and when this insulin doesn't work properly, sugar builds up inside the blood, leading to high blood sugar. So this high blood sugar can damage your organs over time and can lead to serious complications. There are mainly two types of diabetes. Type 1 diabetes, which is usually diagnosed in children and young adults, but the body cannot produce insulin at all. It is a type of an autoimmune disease where your pancreas gets damaged by an overzealous immune response inside your own body. The cells which produces insulin gets destroyed. So the insulin is not produced at all. Second is type 2 diabetes, which is more common in adult, and it is now what we call as a lifestyle disease because it is often linked to lifestyle factors like obesity, poor diet, lack of exercise, unhealthy eating habits, unhealthy sleeping habits. So these are all getting very much prevalent in our youngsters, and that is why the youngsters are getting more and more diabetes. Earlier it used to be a disease which we say that you get it after the age of 50. But nowadays I am seeing even 30-year-old getting diabetes, and that too uncontrolled diabetes. So what are the symptoms that we need to watch for? Firstly, early detection is the key. Some of the common warning signs include increased thirst and frequent urination, unexplained weight loss, extreme fatigue or tiredness, blurred vision, slow healing of cuts or infections, or getting serious infections inside the body. If you notice any of these symptoms, please consult a doctor and get your blood sugars checked. So I often say that don't get the checkup done when the symptoms develop. Check it before the symptoms develop. So that is why the role of annual health checkup or getting yourself checked every year by blood test and by consulting a doctor is very important. So anybody who is more than age of 25 years, I would suggest that start doing the annual blood checkup now so that you can catch the disease early before it has gone out of the hand. Now, what are the risk factors for developing diabetes? So certain risk factors which increases your risk of developing diabetes in future are family history of diabetes, which is very important. If your family member had diabetes, then you are at very high risk of getting diabetes. So please do routine blood tests to rule that out. Overweight or obesity, because overweight or obesity causes a state of insulin resistance. So your body is producing enough insulin, but it is not able to utilize it because of the obesity. Third is sedentary lifestyle, that is again leading to obesity and causing insulin resistance. High blood pressure or high cholesterol. Unhealthy diet, which is rich in sugar and processed food. More and more of eating junk food and not eating healthy food. Age more than 40 years, that is more risk of developing type 2 diabetes. So doing lifestyle changes can help reduce your risk significantly. We will discuss about that also. Firstly, let us discuss what are the complications if you have an uncontrolled diabetes. So uncontrolled diabetes can affect many organs, heart and blood vessels, which increase the risk of heart disease, heart attack and stroke. Kidneys can lead to kidney failure. Eyes, risk of diabetic retinopathy, which can cause vision loss. Nerves, causing tingling, numbness or diabetic neuropathy. Feet and skin, poor healing and infections can lead to serious complications and some deadly infections. So early detection and proper management can prevent or delay these complications. So now we will discuss the prevention and management of diabetes. Even if you are at high risk, there is a lot that you can do. Eat healthy diet, eat plenty of vegetables, fruits, whole grains and lean proteins. Do regular exercise. Aim for at least 30 minutes of activity most of the days. I generally recommend 5 days in a week is enough, but at least 30 minutes of dedicated exercise other than what you do while commuting to work or anything. maintain healthy weight, and avoid excessive eating of processed food. Nowadays, Zomato and Swiggy have made our eating habits very poor, and we have gone into a cascade of eating junk food every day. Please avoid that. Maintain healthy eating habits, and 90% of the problem will be solved. Maintain healthy weight and getting regular checkups done. Monitor blood sugar levels, blood pressure, and cholesterol. As I mentioned earlier, after the age of 25, each and every individual should have an annual checkup done and get yourself checked with by a doctor also. If your doctor has prescribed some medicines, please remain adherent to it. Do not start or stop any medicines on your own. You feel fine and you stop that. That is not the answer. Prescribed insulin or oral medications have been advised. Please take them as advice, and please take them at regular intervals or regular timings. Lifestyle management, that is avoid smoking and limit alcohol as much as possible. For type 1 diabetes, insulin therapy is essential. You cannot stop insulin at any point of time. This is an irreversible diabetes. You will have to take insulin for the rest of your life. For type 2 diabetes, those can be reversed if it is treated early, caught early, and combined with lifestyle changes. It can work very effectively, stopping the progression of diabetes or even reversing the diabetes. So, key message that I would give you today on World Diabetes Day is that diabetes is preventable and manageable, but early detection and healthy habits are crucial. If you are starting medicines but you are not doing lifestyle changes, then it is not going to have its effect. Only medicines will not work. You will have to do lifestyle changes also. If you or someone you know is at risk of having diabetes, take action today. Get yourself checked today, because small steps like eating right, exercising, regular checkups can make a huge difference in your life. Stay informed, stay healthy, and let's make this World Diabetes Day come.